Good morning. So today we're going to learn interpretation of the different waveforms on our IABP or intra-aortic balloon pump waveforms. So this is actually our actual console, and I'm just going to show you the IABP catheter here. So this patient actually came in with cardiogenic shock and a balloon pump was placed. Really, the indication for your IABP is to support your hemodynamics, increase your cardiac output. So place on the left femoral. This tubing here is where your helium goes. This is your helium catheter. This is your actual intra-aortic balloon pump catheter, and then you have this tubing for anticoagulation. So we're actually using heparin. And this is your actual console here. So first waveform, that's your EKG. So patient is on sinus rhythm with a heart rate of 76. This one here, the green. And this is your intra-aortic balloon pump pressures. You have your assisted SBP. This is your unassisted SBP. Assisted diastole. Unassisted diastole. The third waveform that you see is the actual inflation and deflation of your balloon. And you see the augmented pressure here, which is 134. So that's the actual peak pressure inside your balloon. So that's 133. And you see the sign here. This is actually your helium tank. So it's just giving you like a level of the helium in the tank. So right now, as you can see, the patient is on 1:3 frequency. It simply means like the balloon is inflating, deflating every third cycle, every third cardiac cycle. So I'm going to show you. We'll go back to 1:1. So that's every cardiac cycle. The balloon is inflating and deflating. So every cycle, as you see, you have inflation and deflation. The same thing with the waveform here. This is actually going up, that's inflation, and then it comes down as it deflates. And every cardiac cycle it has that. We'll go up, I will go down to 1:2 frequency. So every second cycle, you have inflation and deflation happening. And she was on 1:3, so we're gonna go back to that. 1:3. So every third cycle, inflation and deflation. Just a quick review. We know that what are the indications for the IABP? We use this again for cardiogenic shock. Simply means like you have decreased cardiac output, or for patients like who have MI. It's also used as a bridge for open heart CABG or for high risk PCI patients. Today we're actually going to be removing it. We usually wind down from 1:1, you go down to 1:2, 1:3, and you see if the patient is maintaining her own unassisted or intrinsic cycle. So D, I'm going to show you D. I have D here. It's actually the patient's wonderful nurse. I'm just going to do like a standby, and then as you see, the assisted numbers, went away, and also your inflation, deflation waveforms are gone, right? So what you're actually seeing is the patient's actual blood pressure. You have 104 and 81. So the numbers are actually good. And your map is 91, yeah, correlating with your art line. And again, there's no augmented pressure, right? Because, we have it in standby. So far, so good. Heart rate's also okay. We're gonna restart this. Going back to the 1:3 frequency. 1, 2, third cycle. 1, 2, third cycle, right? So this is actually your unassisted systole. This is your assisted diastole. And this is your end diastolic pressure here. So this is after your end diastolic pressure. This is actually your assisted systole. So your assisted systole is actually lower than your unassisted. The same thing with your diastolic, assisted diastole. It's lower than your assisted diastole. that's it. Thank you so much. Hopefully, we have good understanding of the different waveforms that we see in our console. Thank you.